Good afternoon, guys, and welcome to the Tuesday afternoon kitchen talks. My name is Paul Corliss, and I'm a healthy lifestyle advisor at Cardiac and Cancer Rehab at Livewire. So today's subject in the kitchen is heart health and symptom awareness, and I'd like to introduce you to a good friend and a colleague at Warrington Hospital is interventional cardiologist Dr Ahmed Farag. Welcome to the kitchen, Ahmed.
Hi, Paul, and thanks very much for inviting me to be here with you today. I think it's an excellent initiative, what you're doing, because during this lockdown period, people still need these healthy nuggets of reminders of how to stay healthy, both physically and mentally. So well done for the initiative. It's an excellent one.
Absolutely, and it's been really important, especially it's been noted in the news. Obviously, I pick all the heart attacks up from the rehab side of things, but you see the acute heart attacks, and nationally there's been a little bit of a drop as well, people attending A&E. So have you got any messages for the members of Warrington with specific cardiac symptoms?
Yeah, I think this is an excellent and important message, Paul, because we know that nationally, even the number of acute heart attacks, these are proper acute heart attacks presenting in hospital has fallen by 50%. So the question then is, where are all the heart attacks patients? And the message we want to get out there is that if you have symptoms of heart attacks, and I'll come to that shortly, then you need to get in touch. You should not be sitting on your symptoms or ignoring your symptoms, because COVID obviously is a big risk of contracting COVID or coming. The message is clearly stay at home, but equally having a medical condition for which you need to be in hospital, like a stroke or heart attack, then you need to be, because that's the safest thing for you to have. The difficulty, I guess, Paul, with heart attack is that sometimes the public or the do not know what symptoms to look for heart attacks. So everyone or people think that heart attack is severe chest discomfort, clenching the chest, and so on. But quite often we see heart attacks presented in the presentations in the form of chest tightness, chest pain, discomfort, aches, jaw, throat pain, aches, sweaty, nausea. And my message really to the public is that if you're having symptoms that you're not sure about, symptoms that are not getting better, then you need to get by GP or come to the hospital through the, because it is really important that we do not miss the boat when it comes to serious diagnosis like heart attacks or strokes. Don't suffer in silence. Don't sit on your symptoms. Don't ignore your symptoms. We've got the capacity in the hospital to assess you, to admit you, and to treat you in a safe and efficient way. So this is really my message when it comes to heart attacks.
Yeah, absolutely, yeah, and especially all our cardiac rehab clients who are exercising at home as well, making sure you're warming up and you're having your GTN spray, your angina spray when you're exercising as well. One of the big subjects me and Dr. Farag have been doing over this last couple of years, we've been doing a lot of atrial fibrillations and something called the Smart Heart Plus event, and we've been going around to a lot of local in our Livewire home of Arthur Jubilee Park, and we've also been to a few shopping centres, a few workplaces as well. So I think it's really important is people learn how to take the pulse, especially if they're sat at home as well, and to learn the right pulse and pick up any irregular heartbeats and such like atrial fibrillation and things like that. It'd be really reduce the risk of stroke and heart attack as well. So have you got any advice for members of the public, Ahmed, for taking their own pulse at home?
Yeah, thanks, Paul. So this is a topic that is really very close to my heart, which is about cardiovascular disease prevention, so preventing heart attacks and stroke. And when it comes to preventing heart attacks and stroke, atrial fibrillation is a big risk. So atrial fibrillation basically is an irregular heart rhythm. The heart runs out of sync. And when this happens, there's a risk of clots forming inside the heart, and then these clots can cause all sorts of trouble, including strokes and heart attacks and so on. Now, traditionally, you pick up an irregular heart rhythm either by patients complaining of symptoms of palpitations or breathlessness, dizziness. But the problem with atrial fibrillation is that a lot of the time it's asymptomatic. The patients are not aware of symptoms, and obviously, the risk is that the first symptom that patients would present is a stroke. So what we've been trying to do really is to try and introduce a cultural change and shift whereby patients are able to pick up their own pulse and detect if there's an irregularity or not, because it's relatively straightforward, and I think it's a life skill that everyone should have, and even children should be taught. And the easiest way to pick up if you've got irregular heart rhythm is to check your pulse. To do that, the most important in our body is the carotid pulse. So lift your neck up, find your Adam's apple, slide your fingers gently to the side of your neck and press there, and then you should be able to feel your carotid pulse. Now, when you're doing that, you should be able to count 4 or 5 regular consecutive beats. So it should be going like boom, 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 like a clock. If you're able to do that, it means your heart rhythm is regular. That's good. If on the other hand, you start seeing that it's coming all over the place or irregular, then this is when you need to start seeking help. Check with your GP, your pharmacist, in order to see if you've got this condition of atrial fibrillation.
Absolutely, yeah, because we do know when people have got an atrial fibrillation related stroke, it tends to be a lot worse, and the other types of strokes, obviously. So just an easy manual test as well, and looking at high blood pressure as well. And I think it's really important. And I wrote a little bit of an article for our BACPR magazine about people really having the time now to, because people tend to be a little bit less stressed and has a certain level of anxiety, but actually starting thinking about the cardiac health. I know last week we had Dr. Tom Butler and he talked a little about cardiac nutrition, looking at your weight management and looking at your stop smoking. These are all risk factors what reduce your risk of high blood pressure and atrial fibrillation. And I'm going to just say next week we've got one of our stop smoking advisors coming on for questions and answers. And just to let everybody know, the smoking team is still operational at the moment. So if you still want to stop smoking, get in contact with Livewire Stop Smoking Service. Come on our social media platforms or on the website, and then you can come and start smoking now. You can get your medication, some virtual, some on the call telephone. So the service is still operational.
Absolutely, because particularly when it comes to heart health, so we know, for example, that atrial fibrillation is responsible for 1 in 5 strokes in the UK, and that atrial fibrillation related strokes tend to be much more aggressive than non-atrial fibrillation related strokes. So it's really important that we are able to detect it early in the onset of symptoms. And the good news is that once it's detected, it's relatively easy, straightforward to treat with blood thinners, whether it's warfarin or alternatives to warfarin. There are treatments which will significantly reduce the risk of someone getting a stroke from fibrillation. The difficult bit is detecting it in the first place, and I think that's where we should be focusing and causing this cultural and mentality shift whereby patients are actually checking their own pulse, checking any
Absolutely, yeah. And if anyone's interested, when we get back to the new normal, with Livewire, we've just started some health and wellbeing checks, and what we will do is a cardio device mini touch ECG review. We'll do your HbA1c, what's your blood sugars, so an average over 3 months, so look at your risk of diabetes. We'll do your blood pressure, we'll do your height, your weight. You'll get a session with a lifestyle advisor, so we can bring all these cardio protective advice. So have a look on the internet for Livewire health checks, and we'll be able to give you a good health analysis of moving forward as well.
And perhaps, yeah, go ahead, Paul.
So one of the questions one of my cardiac rehab clients asked me as well, and a lot of the time when I'm delivering the session, patients are, "Oh, Paul, can you just check my blood pressure? Can you just do this?" Would you recommend people to have a home blood pressure, or do you think sometimes people get quite addicted to it?
Sure. So I think blood pressure again is a very hot topic and a very close subject to my heart, because we know again that high blood pressure is when it comes to it is one of the single most common risk factors for coronary disease, for strokes, and again, like atrial fibrillation, it tends to be asymptomatic. So it will be there in the background for years and years, causing problems until, fortunately, someone presents with a heart attack or stroke or heart failure and so on. So it's really, really important that, again, the public own their health and start checking the blood pressure, whether it's checking it through the GP or through the pharmacist or having a blood pressure machine at home. It's really important that you know your numbers. And again, the good news here is that there are lots of things in our own hands that we could do to affect our blood pressure. So obviously there are medications that are proven to reduce the blood pressure. These will be prescribed by your GP. But that we could do ourselves in order to reduce the risk of high blood pressure or reduce your blood pressure. So things like exercising, things like weight loss, things like reducing salt intake, things like stopping smoking. So there's no easy fix, there's no easy solution for any of our medical problems, but there are little things that you could do to help your overall health and overall correct your overall blood pressure figures and numbers.
Absolutely. And if anyone's looking for any more advice, you're very welcome to come back to our team and get a referral from your GP, and we can look at all these cardioprotective health improvements advice. And the British Heart Foundation is a really good website. Change for Life, Happy OK Sad mental health services are available. So there's lots of support there if you need to. So hopefully coming towards the end of the year, we'll be doing some more Smart Heart Plus events. So maybe a few more. Maybe Orford Jubilee Park was really successful. You can come down, have your pulse and your blood pressure checked, and have a chat with the clinicians or the health advisors, stop smoking advisors. So that was great, Ahmed. So thank you very much for coming to the Kitchen Talks. We'll do it again sometime. I think we're both due a haircut though, so I think we'll get that booked in soon as lockdown. Okay, so thank you very much, guys. We'll see you next Tuesday, 3 o'clock for the Stop Smoking questions and answers. Stay safe, look after yourself, washing your hands, and we'll catch you all soon. Thank you very much.